So how do you treat 3PD or persistent postural perceptual dizziness? If you're not familiar with the diagnosis, make sure you catch my previous video on what is 3PD. As far as treatment options, I have been treating people for over a decade successfully with vestibular therapy, using a cognitive behavioral therapy approach with my technique in making you feel safe in your body again. When it comes to 3PD, oftentimes my patients are anxious, fearful, and avoiding anything that will provoke symptoms. Because the brain is hypersensitive to anything that would cause dizziness, it sets off the alarm, and then the dizziness builds and builds and builds until you don't want to do anything. So how do you treat 3PD or persistent postural perceptual dizziness? According to the research, the treatment approach that's most successful for 3PD is vestibular therapy, SSRIs or SNRIs, not all cases, but it is recommended, and then cognitive behavioral therapy approach. So let's go through each one of those and define exactly what that looks like. So as a vestibular therapist, of course, I am more well-versed and can speak to the vestibular therapy. My 4 principles include gaze stability, grounding and balance exercises, which is probably my top priority, cardiovascular exercise, and habituation, which is self-movement provoked and visually provoked. So with gaze stability, if you're not familiar with that, those exercises include vestibulo-ocular reflex exercise, meaning anything that gets the head moving and the eyes stable on a target. I have plenty of videos on gaze stability and even a playlist if you want to check those out. But let's go through a couple of exercises that you can start on today. And why we do this is to get the inner ear, brain, and eye complex to function as best they can. 3PD is a condition where the brain is hypersensitive to its stimuli. In most cases, that's visual stimuli. If the vestibular system is broken or not reliable, the brain picks the eyes over anything else, and that causes problems. So we need to make sure we can strengthen the inner ear as much as we can and improve that sense. And we want to make sure that we shut off the visual sense as much as we can. So the most basic gaze stability exercise is going to be VOR times 1. Now I do that near and far. So I will pick an object. Normally it's the tip of a pencil or maybe the tip of my thumb. The goal is to shake your head as quickly as you can with keeping your image clear or just on the edge of blurring, times 1 minute if you can. Everything is modifiable. After any dizziness subsides, you're going to repeat that up and down. So up, down, up, down, up, down, up, down, as fast as you can with keeping the image clear or on the edge of blurring. You're also going to repeat that looking at a distant object. Maybe it's a light switch or a knob of your door. You're going to do that left, right, left, right, left, right for 1 minute as fast as you can, and up, down, up, down, up, down. Now, those exercises you can do daily, up to 20 minutes a day for max effect. That's a lot of time, but space it throughout the day. I have many more gaze stability exercises, but those are the 2 basic ones that you can use to get started. Now, the next approach is going to be grounding and balance exercises. Remember, we need to use our touch system as much as we can and decrease our reliance on our visual system. Grounding and balance exercises are going to be the key in most everything that you do with 3PD. So some balance exercises include, I'll put them up in the corner. It could look like heel to toe standing or single leg standing. The main thing is I need you to carry yourself high. I need you to engage your muscles and feel like you're in control of your body. So for balance exercises, I want you to do 20 minutes a day, a combination of eyes open and eyes closed movements. The main thing you have to do, it's not about the reps, it's about how safe and grounded you feel when you do them. So every time you move, I want you to think about your feet as a clock. Keep your weight in the middle of your foot. If you are doing a turn, for example, and you find that you're swaying from the toes to the heels, try to stop and see if you can get that to stay in the middle of the foot. Curl your toes into the ground, squeeze your buns together. Anything that makes you kind of feel more in control of your body. The third approach I use is cardiovascular exercise. Why do I do this? Well, cardiovascular exercise is actually in the research more effective than using antidepressants. at getting the right amount of serotonin and dopamine up to the brain. There actually is a specific formula to follow. Your third approach, I want you to shoot for 150 minutes of cardio a week at 60% of your max heart rate. How do you figure that out? You take 220 minus your age, times that by 0.60. That is your target heart rate. So your warm-up doesn't count. When you finally get into your heart rate zone, that's when you hit your timer. And for a total of 150 minutes a week, however you want to split it up, I want you to try to achieve that goal. And why we're doing that is to get blood flow up to the brain and get those chemicals that kind of give us the bad hypersensitive messaging from the brain, gets those to be more level, and our symptoms will come down because of that cardio exercise. I really do think it's one of the missing links. It's great for our cardiovascular health, our mental health, and the science is proving that it's actually 1.5 times more beneficial than an SSRI or SNRI. So I'm all for exercise over taking pills if I can get away with it. So the fourth and last approach is going to be habituation. Now, the movement-based is actually very similar to the grounding exercises. If there's a particular motion or task that bothers you, say, for example, it is unloading the dishwasher, you are going to pick 1 or 2 tasks a week and repeat that task until your brain desensitizes and no longer causes dizziness. So we would start with grounding while taking our dishes out of the dishwasher and being very present with what our body feels. Do I feel like I'm spinning, or do I feel like my feet are on the ground? If it is when we step into a Costco, I want you to habituate to walking into a Costco. So some clients are so severe that we have to imagine walking through the aisles of a Costco, and then we are able to actually physically get into a store. Of course, it is easier when you can ground, so hold on to a cart, and you're gonna set a timer and see how long you can go without causing panic, fear, or unsteadiness. If that is 2 minutes, unfortunately it's 2 minutes and then you have to leave. The next time you go, maybe it's 3 minutes, and so on and so on. And over time, your brain habituates and desensitizes to that noxious stimulus that causes your dizziness. But again, you have to do it feeling safe and not triggering that fight or flight reflex. And it's a lot easier to say than do. So I understand it might take a year for you, it might take a month, but remember, habituation is the technique of desensitizing by giving yourself repeated exposure to something that bothers you until your brain is no longer bothered by it. The other habituation technique that I use is visual habituation. So this normally involves optokinetic training. So what I want you to do is maybe pick something that bothers you. Maybe it's an airport, for example. You go onto YouTube, you look up GoPro videos of airport, and I want you to sit in a comfortable chair and watch that video of the airport for anywhere from 3 to 5 minutes. I don't go any longer than that. And if the camera pans to the left, I want you to feel your butt in that chair and know that you're steady and not use your visual system. You did not pan to the left. You can feel that you are steady in that chair. I have a full video on optokinetic training that explains this in a little bit more detail if you would like more examples. With that being said, that is my 4-pronged approach in dealing with 3PD from a vestibular therapist. Now, I also do want to mention that SSRIs and SNRIs are evidence-based and do actually help with the treatment of 3PD, but some patients don't need them at all, and they do super great with vestibular therapy. Some patients need the medication before they can even tolerate vestibular therapy. Everybody's journey is individualized, and you have to work with your provider to see what's best for you. As far as the different medications that are appropriate, you can talk with your physician, but some examples would be Lexapro, Zoloft, Effexor, and citalopram. There are a few more, and that is up to your physician to see what the right fit and dose is for you. The last approach to dealing with 3PD is cognitive behavioral therapy. Now, I kind of dabble or sprinkle in cognitive behavioral therapy with my vestibular therapy, but there are professionals out there who are trained in counseling and behavioral therapy just for chronic diseases like 3PD. And you would have to probably do a Google search to see who's available in your local area, but having a counselor to deal with yours is evidence-based and is included in the 3-prong approach with dealing with 3PD. So hopefully you found that helpful. If you have any questions, please drop them in the comments below. Until I see you next week, stay healthy, stay strong, and stay steady.